Hello everyone, today we're going to be talking about the urinary system. This is chapter 42 of your book. These are our learning objectives. We're going to list the major organs of the urinary system, locate or position the kidneys in the abdominal cavity, and identify the gross internal structures visible in a coronal section. Describe the renal blood supply and trace blood flow through the specialized vessels of the kidney. Discuss and compare the structure and the functions of the ureters, urinary bladder, and urethra. Explain the mechanism of micturition, which is also known as urination, and name the parts of a nephron, and describe the role of each component in the formation of urine. All right, so we're going to be talking about the urinary system, and this is our body's personal water filter. So it helps keep everything in balance and it removes waste that we don't need. So the kidneys are the main organs of the urinary system, and they work hard to help keep our blood clean. So you can think of them as like high-tech filters that process the blood, making sure that it leaves in a better condition that it came in with. So one of the most important jobs that the urinary system has, specifically the kidneys, is to ensure that we maintain water balance. So if we have too much water, the kidneys work hard to get rid of the extra or excess water, and if we don't have enough water, they help us hold on to the water that we have. So they continue to make constant adjustments to keep everything in check so that our bodies function properly. Once the kidneys have done their job, we have waste. So the waste is what we call urine. So it has to go somewhere, and it takes a trip through the ureters, which are small tubes that leave the kidneys, and they land in the bladder. So that's where the urine gets stored. And when it's time, it will exit through the urethra. So basically, the urinary system is all about filtration, balance, and also waste removal. And it's going to ensure that our body is running smoothly. All right, now let's talk about where the organs of the urinary system are actually located within our abdominal cavity. So the system isn't just about getting rid of waste, it is also closely connected to some other pretty important parts of the body. So we're going to start with the kidneys. All right, we have the right kidney here and the left kidney here. So we have two kidneys, one on each side of our spine. Of course, the spine would sit in the middle. We can't really see it because it's covered up right here by these arteries and veins. All right, so we have again one kidney on each side of the spine, and they are just below our 12th rib. They sit near the liver on the right side and also near the spleen, which is on the left side. And each of the kidneys is going to be working constantly to keep our blood clean and also keep everything balanced. Once the kidneys do their job, we have waste, of course, and that waste is called urine. So the urine is going to move down the ureters. All right, so we have a left ureter here and we have a right ureter here. It will move down the ureters like it's moving down a highway, getting transported from the kidneys to the bladder. All right, and this is where it's going to be stored until it's time for us to use the restroom. All right, now let's take a look at the renal artery. All right, your renal artery is here. All right, the renal arteries bring dirty blood to the kidney so that it can be clean. And then you see the renal vein here. The renal veins will send that filtered clean blood back into circulation. So the whole process keeps our body fluids in check, and it ensures that we're getting rid of toxins that we don't need. All right, finally, when our body is ready to get rid of the urine that has traveled from the kidney down the ureters to the bladder for storage, when we are ready to get rid of the urine, it exits through the urethra. All right, so this is a tube that allows us to excrete the urine from our body. All right, so again, the urinary system is constantly going to be working in order to maintain that healthy balance that we need. All right, we took a look at the anterior location of the kidneys, and now we're going to take a look at the posterior location of the kidneys and also a cross section of where the kidneys look. So they don't just sit or hang within the body. They're actually located again on either side of the spine. So here we see the spine here, and here's a drawing of the left kidney, and of course here's a drawing of the right kidney. All right, in addition to being located on either side of the spine, they're located between the 11th and 12th ribs. All right, so it's showing you here the drawing of our ribs here. The 11th and the 12th rib is here. All right, and they stretch all the way down to about the 1st to the 4th lumbar vertebrae. All right, the vertebrae sit here, and this is the first lumbar, so this is like our lower back. This is the first spinous processes of the first lumbar vertebrae, L1, and this is L4, the spinous process of L4 right here. So that means they sit pretty high in the abdominal cavity, but not quite in our rib cage, as you can see, because these are the 11th and 12th ribs right here. All right, so again, they're not just floating around in the body. They are, if we're looking at this cross section right here, they're tucked behind a protective lining called the peritoneum. All right, and the peritoneum is right here. All right, so that is basically what protects the kidneys. All right, it's also located in what we call the retroperitoneal space. So there basically means that they sit towards the back of our abdominal cavity rather than inside of the main portion of the abdomen where the stomach and the intestines are. So in the cross section, we can also see in this cross-sectional drawing the inferior vena cava and also the abdominal aorta. All right, abdominal aorta is here and the inferior vena cava is here. All right, and those are two of the biggest blood vessels in our body. These are super important because they help carry that blood to and from the kidney so that it can be filtered. So if you've ever heard someone say that their kidneys hurt and they're pointing to their lower back, this actually now would make sense to you because you see that they are positioned towards the back or the rear of our body in our what we call our flanks. All right, and again, this is why someone with kidney issues or kidney pain might also have what we call back pain, and that's because of the location of the kidneys. All right, so now we're going to talk about the kidney in terms of the shape, the size, and also the location, which we've talked a little bit about the location already. So in terms of their shape, they are considered to be bean-shaped organs. So in terms of size, they're about 11 centimeters long, 7 centimeters wide, and 3 centimeters thick. So roughly, if you could compare it to something that we see every day, about the size of a bar of soap. So when I say bean shape, that means they're kind of oval and they have a small little indention in one side. And that indention is called the hilum. And this is where the blood vessels and the tubes connect to the kidney. All right, now the kidney, in terms of where it lies, the kidneys sit again on either side of our spine between T11 and between the T12 and L3 vertebrae. Some people say that it can even go down to L4, which is what we saw on the last slide. So that's basically in the lower back or near the lower back. All right, the left kidney, which if you go back and look at the previous slides, the left kidney is actually a little bit bigger than the right one, and the right kidney sits slightly lower. All right, there is a reason for that because that's because the liver takes up more space on that side. All right, so to keep them in place, the kidneys are held by a renal fascia or fascia, depending on how you would like to pronounce that word. All right, and fascia, renal fascia is a type of connective tissue that anchors the kidneys to nearby structures. So They also have a built-in cushion, all right, so or fat pad, and each kidney is surrounded by what we call a renal fat capsule, also known as the renal fat pad. That's the built-in cushion. So that's a thick layer of fat that helps protect them from injury. All right, and again, we did say that the kidneys sit in the retroperitoneal position. So they sit behind the peritoneum, which is a lining that's inside of our abdominal cavity. All right, and that's why they're more towards the back of the body rather than inside of the abdominal cavity with the stomach and the intestines. In terms of what they do, if you think about the kidneys, they are filtering our blood 24/7. They filter the blood. They ensure that we have that balance of fluids, and they also get rid of the waste. And they do that all while being tucked away behind layers of protection of layers of fat, which is this renal fat pad. All right, so now that we know where the kidneys are located, now we're going to take a look inside of the kidney. So we're looking at a coronal cross section of the kidney. All right, this is just a drawing, but we will take a look at a human kidney on the next slide to look at the internal structures. So the first thing you can notice about it is the outer layer. All right, so the outer layer of the kidney, it's called a fibrous capsule, and its job is to protect the kidney. So it's basically like a protective shell that keeps the kidney safe. Just underneath that, we have the cortex, all right, which is where a lot of the filtering begins. All right, then we get into the medulla. All right, so here's the medullary pyramids there, and then we have the medulla here. All right, so we get into the medulla, which contains these triangular shaped sections. All right, and you can see these triangular shaped sections here. All right, the triangular shaped sections are called the renal pyramids, which that wording was right here, or medullary pyramid or renal pyramids. All right, and they're of course they help concentrate the urine and send it toward the center of the kidney. All right, the renal papilla at the tip of each pyramid acts like a funnel. So let's see if I can find the wording here. Renal papilla. Renal papilla. All right, so it's only listed on one of them. So again, it acts like a funnel, and it's at the tip of each pyramid, and it helps drain the urine into these collecting spaces called the calyces. All right, and the calyces here, these are the collecting spaces. All right, so everything will eventually lead to the renal pelvis. All right, so this is our renal pelvis here, and the wording for renal pelvis is here. All right, so that's the renal pelvis, and that's the last stop before that urine is going to head down the ureter on its way to the bladder. And let's not forget the renal artery and the renal vein. All right, the renal artery and the renal vein on this picture. It's not on this picture. However, I do want you to note that the renal artery and the renal artery will bring the unfiltered blood into the kidney, and the renal vein will take that clean filtered blood back into circulation. All right, so this is just an artist's rendered drawing of the kidney. And of course, this is an actual drawing, not an actual drawing, an actual cross section of a human kidney. Again, it's showing you the same things. It's just a human kidney versus an artist rendered kidney. And again, I don't think we mentioned the hilum on the other one, but the hilum is the notch we talked about earlier that makes it look like a kidney bean. So it's oval in shape, and then this notch right here is what actually makes it look bean-like in shape. All right, and again, you can see the ureter. So this ureter would eventually lead to the bladder. We see the capsule, the fibrous capsule on the outside. Next, we see the cortex layer, and then we have the medullary pyramids, which are, they said they are triangular in shape. And then, of course, we have the renal pelvis right here. And that is pretty much it. Same thing we saw on the artist drawing. This is just now a actual kidney. So we did view a drawing of a kidney and an actual preserved kidney. So now we're just going to talk a little bit about some of those structures and the different layers that we saw within the kidney. So we're going to start off first with the renal cortex and the renal medulla. All right, and these are basically the outer and the inner layers of the kidney. The cortex is where a lot of the filtering happens, and the medulla is going to help process and transport that urine. All right, inside of the medulla, we have the renal pyramids. These are those triangular sections that we talked about, and they help concentrate the urine and move it towards the center of the kidney. All right, between the pyramids, which we didn't really talk about them, but let's say we had those triangle shapes. Between each of the triangles, we have the renal column. So these are just the spaces where the cortex dips down into the medulla, and it helps give it support, and also it helps give it structure. All right, now that the urine is ready to leave the pyramids, it goes into these cup-like structures called the calyces or calyx. And think of these like little tiny funnels. They're collecting all of the waste, and then they will lead it into the renal pelvis. All right, so we're down here at the renal pelvis, which is like a big collection basin before that urine flows down the ureter and heads down towards the bladder. All right, so now let's talk a little bit about the blood vessels of the kidney. And the only slide that I can recall showing us the renal artery and the renal veins was the anterior picture, the very first picture that we looked at. However, I do want you to note that kidneys are highly vascular, so they basically have a lot of blood vessels. All right, their main job again is to filter that blood, so it does make sense that they're highly vascular, and they need to have a steady supply coming in and out. So it all starts with the renal artery. All right, the renal artery is the major branch off of our abdominal aorta, and think of it like a highway that delivers oxygen-rich blood straight to the kidneys. All right, once inside of the kidney, the renal artery splits into smaller sections or smaller roads called interlobular arteries, and they travel between the renal pyramids and the medulla. So from there, even those smaller vessels called afferent arterioles, they branch off and lead to the nephrons, which is they're tiny microscopic filters that actually clean our blood. All right, after the blood gets filtered, it doesn't just sit there. It does move through a network of veins, eventually leaving the kidney through the renal vein and heading back into circulation. So it's basically like a, if you think about a water filtration system, but of course we're filtering blood. The blood comes in dirty, it gets cleaned in the nephrons, and then it flows back out fresh and ready to go. So the kidneys, they're constantly working to filter around 50 gallons of water a day, which is pretty amazing if you think about it. All right, so now we're just taking a look at how that blood is circulating through the kidney. So we're basically looking at the system, the system of arteries and veins that we have to help filter out that 50 gallons, approximately 50 gallons that it processes in a day. So it all is going to start here with the renal artery. So this is the large blood vessel that's bringing in oxygen-rich unfiltered blood from the heart. So it brings it straight into the kidney from here through this artery, renal artery. From there, it does branch into smaller vessels, and these smaller vessels are called segmental arteries. So if you see right here, the red, these are segmental arteries. All right, then it goes into lobar arteries, and then finally into interlobar arteries. So we have the lobar arteries there, and then we have the interlobar arteries here. So they're very much smaller than that. And then and this is basically what weaves between these renal pyramids. So now we can actually see the renal pyramids here. All right, so and then the renal columns, these are the spaces in between the renal pyramids. All right, now near the border of the cortex and the medulla, so up in this area we have what we call arcuate arteries, and these basically arch around the top of the pyramids, and from here even smaller afferent arterioles carry blood into the nephrons, which are the tiny filtering units inside of our kidney. All right, after the blood is filtered, meaning all of the waste is removed and only the good things remain, like nutrients and water, and of course it's balanced, it travels back through a network of veins. All right, and eventually it will leave through this renal vein right here. So the veins, the network of veins is blue, and the network of arteries, of course, is red. All right, on this side we see what we call an arteriogram. So this is a radiologic type study, and it basically shows the blood flow through the kidneys. So doctors or the radiologist basically injects a contrast dye to highlight where these blood vessels are. And if you're getting this type exam, arteriogram, we're kind of looking at whether or not there's any blockages or other issues within the vessels of the kidney here. Again, we have what we call dirty, unfiltered. It is oxygen rich, but it's dirty, unfiltered blood will enter the kidney. It will be filtered into the nephrons, and then it'll leave clean so that it can go out towards the body to the organs that need it. All right, in this arteriogram, it does label all of these arteries and vessels that we talked about. All right, so we talked about the kidneys. Now we're going to look at the last few parts of the urinary system, basically how the urine gets from the kidneys to the outside of the body. So these are the last few remaining structures that will make that happen. So we start with the ureters. All right, and the ureters are these thin tubes that connect to each of the kidneys, and it connects the kidneys to the urinary bladder. So if you think of it as like a highway that's transporting that urine from the kidneys down to the bladder to be stored, temporarily stored. All right, the walls of the ureters, they're made up of 3 layers. All right, we have a mucus lining, we have a middle muscular layer, and we have a fibrous outer layer, and that helps push the urine down through rhythmic contractions, which we also call those rhythmic contractions peristalsis. All right, the bladder is where the urine just hangs out until it's ready, until our body is ready to get rid of. So it's basically a muscular storage bag, so to speak, that can expand as it fills with urine. When it's empty, the bladder is small, but as it fills, it's able to stretch, kind of like a balloon, so to speak. When you're putting water in a balloon, you can see how it stretches. So that's why we can feel an urge to go to the restroom when the bladder is actually full. All right, the inner lining of the bladder, it's made up of a special type of tissue called urothelium. All right, urothelium. All right, and urothelium can stretch without breaking. And it also has folds called rugae, kind of like the same folds that are in our stomach that allow it to expand when it's filling. All right, so when it's time for us to use the restroom, the bladder does contract and the urine is expelled through the urethra. All right, the urethra helps expel the urine from the body, so it allows the urine to leave. All right, so again, the kidneys make the urine, the ureters transport it, the bladder stores it, and the urethra gets rid of it. All right, so now we're going to take a look at the entire urinary tract, and this is a sagittal view of the body, or a side view of the body. And when we talk about the entire urinary tract, that's the complete pathway that the urine will follow from the kidneys all the way out of the body. So again, these are sagittal views. On the left, we're looking at the female urinary system, and on the right, we're looking at the male urinary system. All right, both of the systems, female and male, they will share some of the same basic structures, which are the kidneys, the ureters, the bladder, and the urethra, but there are some differences in them, especially in the lower part of the body. All right, so we're going to start at the top. We're going to start at the top at the kidneys. All right, we already know that the kidneys do all of the filtering, and it sends the urine down the ureters. All right, kidneys to the ureters. All right, and they basically, again, act like little highways leading down to our bladder. All right, bladder, and of course, bladder here. All right, now check out the bladder if you check out the bladder in the image, it's stretched or a little bit distended, as if, you know, there might be some urine in it, so when that happens, the bladder, again, when it's full, the bladder will contract and it will push the urine out and down the urethra. All right, so there's a shorter pathway here for the female, whereas the male, you can see that the urethra has a longer pathway to go in order to exit the body. So again, the female urethra is shorter, located just in front of the vagina, and the male urethra is longer. All right, the urethra is passing through the prostate gland and the penis, as you can see here. Here's the prostate gland here, and here is the penis here. All right, so before it exits, it has to pass through the prostate gland and the penis in order to get out. And this is because the male urethra is also part of both the urinary and the reproductive system, whereas in females it's only for urination. So the urethra for males is dual purpose, whereas the urethra for females only has one purpose, which is to excrete urine. So again, this is the entire urinary tract, from the beginning where all the filtering happens, to the transport, to the storage, and to the elimination of the waste stage, which is the urine. So from the filtering to the transport to the storage to the elimination state. All right, so now we're taking a look at the ureter and how it basically enters into the bladder. All right, and it's designed in a special way for a reason. So as you can see, this is a coronal or a frontal section of the ureter bladder junction. So here's the ureter. Of course, the kidney would be here. The ureter travels down and it enters the bladder. So this is the wall of the bladder. All right, and it does, if you notice, it enters at an angle. It doesn't just enter straight down. And the reason why it enters at this angle is because as this bladder fills up, this ureter acts kind of like this angle helps it act like a one-way valve. As the urine flows down the ureter, it easily enters the bladder, but when the bladder does start to fill up and expand, this junction will close off. All right, and it closes off because it needs to prevent the urine from flowing back up into the ureter. If it didn't move down in this particular direction and it didn't close off, if we did have any type of infection in the bladder, it would allow that infection to flow back up and spread back up to the kidneys, and we wouldn't want that. So it is designed in a special way to ensure that the urine enters the bladder easily and of course stays there. We don't want it to reflux back up the ureter to the kidneys. All right, now we're looking at a cross section of a ureter. So again, we're talking about that tube that carries the urine from the kidneys all the way down to the bladder. All right, so let's start off with the lumen. All right, and the lumen is basically the open space in the center of the ureter where the urine is actually going to flow through. So think about a straw. So think of this as the opening portion in the straw that allows the liquid that you're drinking to leave the cup and be pulled into your mouth. All right, so that's the opening or the lumen. All right, then we have the transitional epithelium here, and this is the inner lining of the ureter, and it's a special type of tissue that does allow the ureter to expand and contract while that urine is passing through it, and the fact that it can expand and contract will help prevent the damage of the walls of the ureter. All right, next we see that we have a connective tissue or lamina propria. It's just beneath that epithelial lining, and this is more of a layer that provides support and also elasticity, and it helps that ureter keep its shape while still being flexible. All right, then we have the smooth muscle layer, and that surrounds the connective tissue, and it plays a role in helping to push or propel that urine down towards the bladder. So instead of just letting urine drip down with gravity, these muscles contract in waves, and that process is called peristalsis. So basically it's actively moving or pushing that fluid down from the kidneys to the bladder. And the last thing that we can see on this cross section is adipose tissue, and this is that fatty tissue that surrounds the ureter, acts like a cushion for protection purposes so the ureters don't get damaged from movement or pressure that's inside of the body. All right, now we're going to talk about the urethra. So this is that tube that allows the urine to exit the body. And the urethra is lined with a mucous membrane called urothelium, and that helps protect it from irritation as that urine is passing through. Now, even though both males and females have a urethra, there are those major differences that we looked at on those two cross-sectional views. So in females, the urethra is shorter. It's only about 3 centimeters long, and it sits just in front of the vagina. So its only job is to transport urine from the bladder to the outside of the body. In males, the urethra is much longer. It's about 20 centimeters, and it does have a dual role. Not only does it carry urine, but it also serves as a pathway for semen since it's connected to the reproductive system. So it's part of the urinary system and also the reproductive system in males. All right, the male urethra, it passes through the prostate gland and it joins with what we call ejaculatory ducts, and it extends them through the penis where it exits at the urinary meatus. So because the female urethra is shorter, women are more likely to get urinary tract infections since bacteria has only a shorter distance to travel into the bladder. So again, the difference between males and females, of course, they both have the urethra for urinary purposes or for the purpose of urinating, but males, theirs has a dual role. It also plays a role in their reproductive system because it carries semen as well. So that is the difference between the urethra for the male and the urethra for the female. Now we're taking a look at the female urethra only and how it passes through the pelvic floor, which is considered to be muscular. So first, let's talk a little bit about the location. So the urethra is positioned behind the symphysis pubis. So that's that bony joint at the front of the pelvis. And it's also situated in front of the vagina. So again, it's a short tube, about 3 to 4 centimeters long, and it's much different from the male urethra that's much longer. So now the pelvic floor muscles that we're looking at here, well, not necessarily looking at here, but the pelvic floor muscles play a major role. So the muscles help support the bladder, the urethra, and also other pelvic organs, and they also control the external urethral sphincter, which is what allows us to voluntarily hold in the urine until we're ready to go to the bathroom. Now, the reason why this is important is since the female urethra is short, of course, it's easier, and we already talked about this, for bacteria to travel into the bladder, which is why women are more prone to urinary tract infections, which we call UTIs. The pelvic floor muscles can also weaken over time. All right, and they can weaken over time based on pregnancy and childbirth. They can weaken due to aging, or the female can have certain medical conditions that allow them to weaken. When it does weaken, it can lead to what we call urinary incontinence. So we can normally hold our urine, but when we have urinary incontinence or leaking of urine, we can't necessarily control it. So things such as coughing or things such as jumping could allow the urine to leak a little bit. We're not able to hold it in voluntarily because of the weakening of the muscle. So as a provider or as a nurse, or maybe even a nurse practitioner one day, it's important to understand these structures, as well as the structure of the pelvic floor when you're caring for patients, especially those that have urinary problems, those that have pelvic pain post childbirth, and also or during pregnancy as well, and then also post some surgical procedures. And it'll again be able to teach women specifically about proper hygiene, meaning how they wipe, how to maybe lessen or prevent urinary tract infections based on how we wipe from front to back versus from back to front. All right, to keep the bacteria levels lower. And also a lot of providers do educate their patients on things such as Kegels, and Kegels will help strengthen the muscles and prevent things such as incontinence. It also can help us understand if we are in a position where we're placing catheters in a female, since the female urethra is much shorter and more sensitive compared to males. It will help us understand or be a little bit more careful and gentle in terms of patient care when we're talking about things such as catheter insertions. All right, now we're going to talk about something that most of us do every day, probably multiple times a day, and we typically don't really think about it unless we really have to go. All right, and that's micturition, or simply that's a fancy name for urination. So micturition is that process of emptying the bladder, and it involves basically a series of muscle contractions and relaxations that happen automatically. However, they are or can be under voluntary control. So as our bladder fills with urine, it does start to stretch. When it's stretching, it is sending signals to our brain saying, hey, I'm getting full, I need to go to the bathroom. All right, in response, we have something called a detrusor muscle in the bladder wall, and it does start to contract as well. And we have an internal urethral sphincter, which is an involuntary muscle that will relax to get things ready for urination. So we don't just pee right away. That external urethral sphincter is what is under voluntary control, meaning typically in most cases we're going to be able to hold it until we can find a bathroom. When we do decide to go, that external sphincter will relax and the urine will be released through the urethra. So again, in most cases, we can hold our urine unless, of course, we have incontinence due to some sort of weakening of a muscle. Now, babies and young children, they can't necessarily control urination, and that's because their nervous system isn't fully developed yet. That's why potty training doesn't happen until they are of toddler age, when the brain and the spinal cord have matured enough to allow for that voluntary control. So typically when they have to go, they're just going to go because they haven't yet trained or learned that what they need to do in order to control or hold that urine. All right, again, in terms of things that can affect this typically voluntary process of micturition is going to be things such as nerve damage from spinal cord injuries or some other diseases like MS, multiple sclerosis. Those can affect our bladder control. Also, conditions like urinary retention, when the bladder can't empty properly, or incontinence, when a person can't hold their urine. And those are conditions that are common in patients as well. And another thing that can affect this control is medications. And medications can interfere with this micturition process. And when you're under certain medications, or maybe you're in the hospital, it might require you to be to receive a catheter in order to help empty the bladder for you. All right, now we're going to take a look at what we call the micturition reflex, which is basically how our body knows when it's time for us to go to the bathroom. So this graph is basically going to help us look at that connection between how the full bladder, when it has all of this pressure inside of it, why we have that urge or why we need to go. So as our bladder starts to fill with urine, the bladder walls do start to stretch. When they start to stretch, the pressure is going to rise. So typically when the bladder reaches a certain fullness, and that fullness is usually between 200 and 300 milliliters of urine, the stretch receptors start to send signals to our spinal cord. All right, at that point, the parasympathetic nervous system responds by triggering contractions of the detrusor muscle, which is the muscle in the bladder wall. All right, and again, as it's sending these signals and these contractions are happening, that starts to increase the pressure within the bladder. As the contractions get stronger, they start sending signals to our internal urethral sphincter, and it causes that internal sphincter to relax. But at that point, we're going to feel the urge to go, but typically we can still hold it. We have control over it based on the fact that that external urethral sphincter is under voluntary control, and we can at that point choose to hold on to the urine, or we can relax it and release the urine if we're, of course, in the bathroom or in a place that we can void. Now, if we do choose to continue to hold on to that urine, the bladder, of course, is going to continue to fill, and these contractions are going to become more frequent, more intense. Hence the fact that the longer you typically hold on to it, the harder it is to hold on to it. Now, babies and younger children, again, they don't have control over our ability to just hold on to it yet. And this is, of course, why we put them in diapers until, of course, their nervous system matures, or we've taught them properly or potty train them properly what to do when they feel that urge to go. So also patients with spinal cord injuries, they might lose that voluntary control of urination, meaning their when their bladder reflex happens, they automatically, without them thinking about it, they won't be able to stop the urination. And other conditions like overactive bladder, OAB, can cause that reflex to be triggered more often or too often, leading to them needing to go to the bathroom more often to urinate. So again, this micturition reflex is what basically tells us when we need to go. And of course, we do have some control over it at a certain age. But if there's weakening or some sort of damage, or either with age, whether we're young, youthful baby, or a non-trained toddler, non-potty trained toddler, or those elderly persons or persons that have injuries that no longer allow us to control it voluntarily, of course, they will not be able to hold their urine. When it's time to go, they need to go. All right, so now we're going to talk about the nephrons. So the nephrons are considered to be like the powerhouse of the kidney, and they're tiny structures that they actually do the work of the filtering of the blood in order to make the urine. So each kidney has about 1 million nephrons, and they're made up of two main parts. They're made up of a renal corpuscle, this is where the filtration happens, and the renal corpuscle includes what we call a glomerulus, which is a network of capillaries that help filter waste. And it's also made up of what we call a Bowman's capsule, which is a cup-shaped structure that catches the filtered fluid. All right, the second part that it's made up of is the renal tubule. And this is a tube, a long tube that helps, it processes the filtered fluid, deciding what gets reabsorbed back into the blood and what gets turned into urine. All right, now in the Bowman's capsule, there is a space between its parietal and visceral layers, and that's where the filtration occurs. So the visceral layer has special cells inside of it, and those cells are called podocytes. And they're structures that create what we call filtration slits, and these slits are what ensures that only small molecules like water, electrolytes, and waste can pass through them, while keeping in things like proteins and blood cells, keeping that inside of the bloodstream. The reason why the nephrons are important is because they keep the body's fluid and electrolyte balance in check. It helps, or they help remove toxins from the blood. And if the nephrons stop working properly, it can lead to things like kidney disease. So again, if they're not working properly, the body can't get rid of the waste properly, which can lead to dangerous health conditions. So even though they're microscopic, nephrons are the reason why the kidneys are able to filter those 50 gallons of blood every day. All right, now we're going to move on to the glomerulus, and this is another important part of the kidney, especially when it comes to filtering the blood. So think of the glomerulus like a tiny blood filter. It is basically a network of small capillaries. They are inside of that Bowman's capsule that we talked about, and its job is to remove waste, remove extra fluid, and also remove any other unwanted substances from the blood. The way the glomerulus works is the capillaries inside of the glomerulus, they have what we call fenestrations. And these are like tiny pores in the walls that allow only certain substances to pass through, while keeping larger things like blood cells and proteins inside. Now, surrounding the glomerulus, we have what we call mesangial cells, and they help provide support, and they also help regulate how much blood flows through that filter. The glomerular capsular membrane is what actually separates the blood from the filtrate, and it has 3 layers, or it's made up of 3 layers. It's made up of the endothelium, which is the lining of the capillary. It has a basement membrane, which acts like a fine mesh filter. And it also has a visceral layer of the Bowman's capsule, which captures the filtered fluid. So the glomerulus is basically where the filtration starts. Everything that gets filtered here eventually is what becomes urine. Now, the reason why this is important is because if the glomerulus isn't working properly, that means that those waste products are continuing to build up in the blood, and that's what will eventually lead to things like kidney disease. So high blood pressure or diabetes, it can damage these capillaries, and over time, if those capillaries become damaged, that will affect the kidney function. So as a healthcare provider, one thing that we check often is glomerular filtration rate, or GFR, and we check that in order to measure how well the kidneys are functioning. So this is a key test that's going to be used to diagnose some kidney problems. So again, even though the glomerulus is small, it does play a huge role when it comes to keeping our bodies balanced and also keeping us healthy. All right, now we're taking an up close and personal look at the glomerular capillary. So we're looking at two images. We're viewing it via what we call an electron microscope. And this is what filtration looks like at the microscopic level. So in image A, we're looking at the surface of a glomerular capillary. And we're looking from the perspective of the Bowman's capsule space. So this is where that filtered fluid is going to collect before it enters the nephron. Now we have two other structures. One is labeled CB and the other is labeled P. So CB is the podocyte cell body. So these are those special cells that help form that filtration barrier. The structures that are labeled P, these are the podocyte foot processes. So these are those tiny extensions that wrap around the capillaries and create those filtration slits, only allowing those small molecules like water, ions, and waste to pass through while keeping those blood cells and proteins inside of the bloodstream. On image B, we're looking at the glomerular capillary wall. So from the inside of the blood vessel is what we're looking at here. So if you look at all of these tiny holes, these are what we're calling the fenestrations, and they help make the capillaries permeable, meaning they allow those fluids and small molecules to pass through easily while keeping those larger particles out. So the reason why this is important, this is because the filtration process is how the body gets rid of toxins and also excess fluid, and it keeps those essential proteins and blood cells where they belong, which is in the bloodstream. So if these structures again become damaged, like with kidney disease or high blood pressure, the filtration barrier can fail, and that'll lead to things like protein or blood in the urine, which is basically one of the first signs or a sign of kidney dysfunction. So again, as a healthcare professional, we are going to monitor glomerular filtration rate to assess kidney health. All right, so now we're looking at a zoomed in view. We're trying to see what's happening at that glomerular capsular membrane, all right, the part that actually is responsible for the filtration. So this is a zoomed in view attempting to show you that filtration process and how the substances will pass from the blood into the nephron to eventually become urine. So as you can see, um, over here, this is the blood. All right, then the next layer, the inner layer, is that capillary endothelium. So this is the innermost layer of a blood vessel, specifically the capillary, where this filtration actually begins. And as you can see, it does have fenestrations, or tiny slits in it, and that's going to allow those small molecules that we discussed, like water, ions, glucose, and waste, to pass through. But of course, it's going to keep those red blood cells and the large proteins inside of the blood. All right, the next layer we have here is the basement membrane. And the basement membrane, that's the middle layer. So think of it like we said it was like a fine mesh filter, and it's going to stop those larger molecules from getting through. So it does have a negative charge, so it will repel proteins that shouldn't be lost in our urine. All right, the next thing that we have here, we have the podocytes. And the podocytes and the filtration slits, those are our outer layer. And the podocytes are those special cells that wrap around the capillaries. They have foot-like extensions called pedicels that create those tiny filtration slits. And these slits basically control what finally passes through into the capsular space. And the capsular space is where that filtered fluid or filtrate will collect before it moves into the nephron. So again, the reason why this three-layered membrane is important because it does decide what gets filtered out of the blood and what stays within the blood. So if this barrier is somehow damaged from things like diabetes, high blood pressure, or kidney disease, larger proteins or even blood cells would be allowed to leak into the urine, which is a sign of a kidney problem. So um, if this does happen, if we have protein in the urine, proteinuria, doctors, that is something that doctors can check for to see for signs of kidney disease. So again, this glomerular capsular membrane is super selective in what it allows to go through and things that what it allows to go through and things that it needs to get rid of. All right, and this is just a continuation of the previous slide where we looked at that glomerular capsular membrane, the filtration barrier of the kidney. And again, if looking at an even closer view of it through an electron microscope, it lets us see the finer details when it comes to filtration. So um, here we have the capillary lumen, which we discussed on a previous slide. That's that space inside of the glomerular capillary where the blood flows. So in terms of the fenestrated capillary endothelium, which is here, if you notice those tiny holes or those fenestrations in the capillary wall, these again are going to allow those small molecules like water, electrolytes, and waste to pass through while keeping the larger molecules like blood cells inside of the capillary. In terms of the basement membrane, again, this is that middle layer. It's that filtration barrier that's similar to a fine mesh that blocks proteins from leaking into the urine while it does allow those smaller substances to pass. And then I don't, it's not really pointed out here, but the podocyte foot processes and also the slit diaphragm, which is here. These are basically the the podocyte foot, the little extensions, are separated by these slit diaphragms that we have marked by these arrows. And the slits act as that final filtration checkpoint, and they basically are going to make sure that only the right substances are going to enter that glomerular space, which is within that Bowman's capsule, to become part of the filtrate. In terms of that podocyte cell body, which is here the CB, in terms of that, these are again those specialized cells that help maintain the filtration barrier, and it ensures that the kidney is working properly. So again, this is just a connection between the previous slide, but showing us a more dialed in microscopic view of it. All right, now we're going to move on to the renal tubule. So we talked about the glomeralis and how it filters the blood. so now we're going to look at what happens in the renal tubule. So this is where the fine tuning of filtration is going to be taking place. So think of it like a processing center. It's going to decide what the body should keep and what should be turned into urine. So within the renal tubule, we have the proximal convoluted tubule, or PCT, and this is the first part of the renal tubule that's located right next to that Bowman's capsule, and it's lined with cuboidal epithelial cells that are packed with microvilli that increase that surface area for maximum reabsorption. So this is where most of the water, nutrients, and also essential ions will get reabsorbed back into the blood, making sure that the body doesn't lose those valuable substances. All right, we also have the descending limb, and that lets water leave the tubule and be reabsorbed into the body, helping to concentrate the urine. We also have the ascending limb as well, and that's one that is impermeable to water, but it does allow things such as salts and ions to be transported out, further helping to adjust that urine concentration. Another thing that is located here is the loop, all right, the loop of Henle, and that determines basically how concentrated or diluted that urine is going to be, which is why, let's say, desert animals who need to conserve water, they have a very, very long loop of Henle. In terms of the distal convoluted tubule and the collecting ducts, this is the final part of the renal tubule before the urine leaves the nephron. So it helps basically fine-tune the pH levels, the sodium, and also the potassium balance under the control of hormones like ADH and aldosterone. And ADH is an anti-diuretic hormone. The collecting duct will gather the processed fluid from multiple nephrons, and it'll eventually send it to the renal pelvis, where it will eventually become urine. So the reason why the renal tubule is important, because if it's not working properly, the body will lose too much water or essential nutrients that will lead to dehydration or electrolyte imbalances. So conditions like chronic kidney disease and diabetes, they can affect this structure, the tubules, leading to problems with our urine concentration. So medications like diuretics basically work by targeting different parts of this renal tubule to help the body get rid of excess fluid, which is why they're often used for high blood pressure or people that have heart failure. So while the glomerulus does start the filtration process, these renal tubules, they're where the decision making happens, making sure that we keep what is necessary and that we send out what is considered to be waste. All right, now this is the final stop in the nephron filtration process. This is the distal convoluted tubule and also the collecting ducts. This is again where those last minute adjustments will happen before the urine is allowed to exit the kidney. So the DCT is the next segment of that renal tubule after the loop of Henle. So it's responsible for fine-tuning of ions, the pH, and also the water balance before that urine is allowed to move into those collecting ducts. So the DCT is involved in things such as blood pressure regulation, and it does that through a special structure called the juxtaglomerular apparatus, or the JGA. So if the blood pressure drops, the DCT signals the JGA to release what we call renin, and that will start a chain reaction that will assist in raising our blood pressure. All right, in terms of the collecting ducts, they're like the final checkpoint before the urine will leave that nephron. So it gathers fluid from multiple nephrons, and it does adjust water reabsorption based on the hormones like ADH and antidiuretic hormones. If the body needs to conserve water, the ADH makes the collecting duct more permeable to the water, basically concentrating the urine. If the body has an excess of water, then less ADH will be released, and that leads to more diluted urine. So the collecting ducts eventually they merge together, eventually draining into the renal papilla, which which is where urine will exit towards the bladder. So the reason why this matters is because the DCT and the collecting ducts, they do work together to ensure that our body is maintaining that stable state of homeostasis, making sure that the body has the right balance of water, electrolytes, and also that the pH is correct. If that DCT malfunctions, the body won't be able to regulate our blood pressure properly, and that will lead to conditions like hypertension. If the collecting ducts don't respond to ADH like they're supposed to, it can lead to excessive urination, things that are seen in like diabetes insipidus. So many diuretics like water pills, they will target this DCT or the collecting duct to help remove excess fluid in conditions such as heart failure and also kidney disease. So while these tubules seem like small insignificant tubes in the nephron, they are really critical for keeping the body in balance and ensuring that we don't lose too much water or that we don't retain too much water. So now we've made it to the renal papilla. So this is the final checkpoint before the urine is going to leave the kidney. So think of the renal papilla like an exit door for urine after it's been processed in the nephron. It's where the collecting ducts empty their contents, which is basically urine, into the next part of our urinary system. All right, so the collecting ducts, which is here noted as CD in this image, they do merge together at the renal papilla, and this is where the final processed urine is going to be drained out. So the urine is then going to move into the calyx, which is listed right here as the letter C, and that's that funnel-shaped structure that collects the urine and then passes it towards the renal pelvis and ultimately the ureter. The interstitial tissue in this region contains parts of that loop of Henle that we talked about earlier, as well as the vasorectal vessels, which are involved in water and also salt balance. So the reason why the renal papilla is important is because this is where the urine will officially exit the nephron, and it's something, if something blocks this area like a kidney stone, it can cause pain and also back up in the system. So the concentration of urine here is basically finalized. So if the kidneys need to conserve water, the urine will be highly concentrated, but if the body has excess water, the urine is going to be more diluted. So again, this is also an area where certain kidney diseases can cause damage, leading to issues like papillary necrosis, where the tissue in the papilla dies due to lack of blood supply, which is sometimes seen in conditions like diabetes and also severe kidney infection. So even though the renal papilla is small, it is very important because it's the last structure in the kidney before that urine is sent on its way to the bladder. So now we're going to take a look at how the nephrons get their blood supply, and we're going to also talk about the two different types of nephrons. So the blood supply of the nephrons, in terms of how it gets it, we have an afferent arteriole, and this is the entry point for blood into the glomerulus, and it carries that blood that we need to be filtered. The glomerular capillaries, this is where the filtration actually happens. And we talked about this earlier. So they remove the waste and also they remove the extra fluid. Efferent arterioles, unlike most capillary beds that drain into veins, the glomerulus drains into another arteriole. So the efferent arteriole exits the glomerulus and it leads into a network of peritubular capillaries, or the vasa recta, which we talked about earlier. So depending on the type of nephron, this is what occurs. So types of nephrons, if we want to know what the difference is, we have cortical nephrons, and 85% of all nephrons are of this type. So they're mostly in the cortex of the kidney. So their loop of Henle is shorter and it doesn't extend deep into the medulla. They do handle most of the filtration and also the reabsorption, but they don't play a big role when it comes to urinary concentration. We also have juxtamedullary nephrons, and about 15% of nephrons are of this type. They do have their corpuscle closer to the medulla, and they also have a loop of Henle that's much longer, so it does dip down deep into the medulla, and they're also surrounded by the vasa recta capillaries, which help create that concentration gradient needed to produce what we consider highly concentrated urine that's important when it comes to the body needing to conserve the water. So the nephrons are critical, especially the juxtamedullary ones, because they determine how much water stays in the body and how much water is going to actually exit the body. So the reason why this matters, that based on, when we're talking about the difference between the two nephrons, is because it determines how well our kidneys can concentrate the urine. If the juxtamedullary nephrons are not working properly, the body may lose too much water, and that would lead to dehydration. If the blood flow to the nephrons is blocked or reduced due to conditions like low blood pressure or kidney disease, that means that filtration is going to slow down, and that would lead to waste buildup in the body. So while all of the nephrons do filter blood, their location and also their structure will determine how much water gets reabsorbed, and also how well the kidneys will adjust to the different hydrations levels. So this is why staying hydrated is important to our kidney health. All right, now we're going to lead into the next learning objectives, and this is where we will take a quick break, but we're going to discuss how the kidneys form urine and trace the path of urine from the point of formation to the exterior of the body. We'll discuss filtration, reabsorption, and also secretion in relation to the formation of urine by the kidneys, and also explain the countercurrent mechanism for concentrating or diluting urine. We'll also explain how urine volume is regulated under normal conditions. We'll describe the physical characteristics of normal urine, and we'll also discuss urinary disorders.